Welcome, everyone. I'm Dr. Rachel Winstead, naturopathic physician and host of the ReBootology Health Podcast, an interview series with leading experts of highly effective natural solutions for the health and happiness challenges faced by the modern woman. Here at the ReBootology Podcast, we don't believe there are bad therapies, just therapies that aren't right for everyone, and we keep looking for better care options. We believe there's a place for both symptom relief and treating the root cause of illness in medicine, and that's why we are excited to be doing this series where we discuss different conditions and wellness approaches with experts in their field. Thank you for joining us for today's interview. Today, we've got Dr. John Neustadt, naturopathic physician, with us. Dr. Neustadt, please say hello to our audience, and I'll give them some of your impressive background.
Hi, I'm happy to be here.
Dr. Neustadt is the founder and president of Nutritional Biochemistry, Inc., or better known as NBI. Dr. Neustadt earned his naturopathic medical degree at Bastyr University, where he was awarded the Founders Award for Academic and Clinical Excellence. Dr. Neustadt has published more than 100 medical articles, written 4 health and wellness books, and is now a #1 Amazon best-selling author in the field of osteoporosis. His most recent book, Fracture-Proof Your Bones, A Comprehensive Guide to Osteoporosis. Dr. Neustadt is also an editor of the textbook, Laboratory Evaluations of Integrative and Functional Medicine, which was used across the United States to train and educate physicians on using functional medicine with their patients. Welcome to the ReBootology Health Podcast, Dr. Neustadt. I'm excited to have you on our show.
Thank you.
I just want to take a moment to remind everyone that we will not be answering questions during our live interview, but feel free to add comments and we will address them afterwards. Okay, first question. John, thank you so much for joining us today. I love your book, Fracture-Proofing Your Bones, A Comprehensive Guide to Osteoporosis. I recommend it to patients and to other healthcare professionals. It's not too technical, and it leaves the reader with a clear understanding of how dynamic our bones are and why it's important to think beyond just a DEXA scan in terms of bone health. OsteoK, a supplement formulated to promote healthy bone density and support healthy bone matrices and maintaining healthy bones, has been one of my favorite supplements to prescribe to patients. And you created that. It was one of your first supplements for your MBI supplement company. Is that right?
That's right. Back in 2006, 2005, I was working with patients and they were coming in with diagnoses of osteoporosis. My mother-in-law has osteoporosis, and I was working with her a little bit nutritionally. I was doing a lot more comprehensive stuff with my own patients. Their bone density tests were going up. And my mother-in-law, who was also on Fosamax at the time, her bone density test was going up. And so her physician was happy. She was happy. I was happy. And then she fell. She tripped on a rug, in a throw rug in her house, and fractured her hip. And I thought something's wrong with this picture. So I started digging into the research more and to understand bone health, bone physiology, osteoporosis, and discovered that bone density test, which is the gold standard, only predicts 44% of women with osteoporosis who will break a bone and only 21% of men. And the real risk with low bone mineral density, the real risk with osteoporosis is fractures. I started then looking through the research and the clinical trials using that lens, looking for nutrients that have been shown in studies, not only to promote healthy bone density, but most importantly, to maintain strong bones. And the best indicator that your bones are strong is that if in clinical trials, there were fewer fractures when people were taking those nutrients or using a certain, a diet or an exercise, whatever that was being studied, that fractures were the outcome. And that's why I ended up formulating OsteoK and then OsteoK minis, because no product existed on the market that had the clinical trial doses and combinations of those key nutrients, MK4, 45 milligrams per day, vitamin D and calcium, shown not only to promote healthy bone density, but most importantly, to maintain strong bones as indicated by over 70% fewer fractures in clinical trials.
I love that. So really a product that was inspired by patients and your mother-in-law's personal story and just the data and what we have been taught in school and taught as standard of care, not matching with the reality of just life. Love that. So you mentioned that the gold standard is a DEXA scan for measuring bone density and detecting osteoporosis. And that's usually a test that women 65 years of age and better, and men 70 years of age and better get to detect osteopenia, which is the step right before osteoporosis. But you kind of already answered this question, but is the DEXA scan really a good tool to use to predict who will fall and break a bone? And if it's not a good predictor of bone fracture risk, what would be a better one? Are there blood tests? Are there different types of imaging that our patients can ask their providers for?
Great question. As I already mentioned, it's not a fantastic predictor of fractures. It's okay. One of the challenges within this field, clinically for doctors and also for patients who are confronting this issue, is that doctors almost exclusively focus on that bone density test result. And when a patient goes in and gets their numbers and that test result, the doctor typically is focused only on improving the number on that test, not thinking holistically and thinking within the context of how do I reduce somebody's fractures. They're treating the number on the test instead of the patient sitting in front of them. And most doctors, unfortunately, are not aware of the limitations of that bone density test. And this is not new information. This goes back to the 1990s. In 2008, this has been known for quite a long time. It's just one piece of a larger puzzle. It is an important test to get, however, and one of the biggest reasons or the best reasons to get it is because first, it does give you some indication of your bone health, but also it is the opportunity to have a conversation. It is typically the stimulus that gets people to become more serious about their bone health and what's going on, because osteoporosis is a condition without any symptoms, similar to heart disease. The first sign that somebody has osteoporosis frequently is a fracture. Now, you mentioned the guidelines of getting screened by a bone density test being women age 65, men 70. There are recommendations put out by the U.S. Preventative Services Task Force, but then there are other recommendations by other medical associations and nonprofits like the Bone Health and Osteoporosis Foundation that take a more nuanced approach, which I prefer. And that is anybody who's 50 years or older, if they break a bone, they should be screened with the bone density test, because you can have bone loss occurring long before somebody hits the age of 65. Additionally,
Absolutely.
I think, and a fracture is oftentimes the first indication of a problem. The second thing I would recommend people do, and as part of the recommendations, is that if you are taking any medications that decrease bone density, that increase fracture risk, and there's a long list of them, that you get a bone density test to see what's going on. And the third thing I would say is that women, when they go through menopause, I like to get a baseline bone density test. I like to see what's going on, because during menopause and for the 10 years after, when estrogen drops, that is the time in a woman's life where they lose bone the fastest. So I like to get that baseline when they start menopause or they start going through that process, so we can track and see the rate of bone loss that's going on. There are other tests out there, but unfortunately, there isn't one that is just phenomenal. That happens to be where we're at. All the other tests are compared to the bone density test. So there are CT scans, there's an MRI, there's ultrasound of the heel that can be done. But all of those are compared to a bone density test, and none of them have been shown to be superior at predicting fractures. Now, there are reasons you might want to use an ultrasound, for example, of the heel. It's portable. It can be in a doctor's office. It can start that conversation. But if that comes up to as an abnormal result, showing some decrease in bone quality, because the ultrasound doesn't actually measure bone quantity, it measures more the bone quality, then that's the person needs to be referred then for a bone density test, a DEXA scan. There is a new emerging technology I'm super excited about. It's called a REMS. It is a type of ultrasound, but it's an abdominal and hip ultrasound. It measures, it sends sound waves through the segments of the vertebrae in the abdomen. So it goes through the abdomen, and it also sends them, you can do it on the hip as well. It was released just in 2019, so it's new. There have been 2 validation studies, one showing it equal to a bone density test. So no better than a DEXA scan at predicting fractures. But the more recent validation study applied what's called a fracture score. And that is, they compared the results from the ultrasound screen to those results of healthy bone. And they compared it to that database of healthy bone. And when they did that, it was actually more predictive than a bone density test at predicting fractures for both men and women. So that's really exciting. I think it's a space to watch. It's not it's not commonly available. It is not widely accepted yet, but if there are more studies confirming that, hopefully it can be something that is used clinically more frequently. Some blood tests are available. Again, none of them fantastic, but some of them can give you some indication and are inexpensive. A complete blood count that's run on routine annual exams will show your white blood cell counts, and that has a macrophage and a lymphocyte. So those are different. Macrophages are a type of white blood cell, and lymphocytes are a category of all your white blood cells for your immune system. And if that ratio is elevated, if it's high, that's associated with bone loss, osteopenia, and osteoporosis. It's basically showing you that you have immune activation, and that can be destroying bone because that causes inflammation. And chronic inflammation not only is a risk factor for many other diseases like heart disease, but also increases your risk for osteoporosis. CRP is another indicator of inflammation. It's not specific. You can't run a CRP and know exactly where in the body the inflammation is coming from. But if that is elevated multiple times, not just a single test, but multiple times, then that can be an indication that you may be at higher risk for osteoporosis. I'm a big fan of getting vitamin D tested.
Me too.
The research supports vitamin D levels between 33 and 40 nanograms per milliliter. That is associated with a maximum hip fracture reduction. So making sure that you're at least that. For immune health, doctors, myself included, recommend even a higher vitamin D level of 50 or above. I just got mine tested. Mine's 64, and I'm very happy with that. Then there are what are called bone turnover markers. Those are markers that are associated with and involved with bone metabolism. So there are 2 types of primary cells in bone. The osteoblasts build new bone up, and the osteoclasts break old bone down. It's a process called bone remodeling, and it's important. We have to have bone remodeling. In fact, every 10 years through that process, you have essentially all new bone. Old worn out bone has been broken down and recycled, and new healthy bone has been created. And in that process, different chemicals are released. So when bone is broken down, you can get markers of collagen breakdown or release, like CTX and NTX. And So that those testing CTX, for example, may give you an indication that you've got bone collagen is breaking down. The challenge with all of those markers, those bone turnover markers, and there's a long list of them, is that there are many things that can interfere with them being accurate. I'll give you some examples. They have to be done in the morning, fasting. If you're a woman and getting tested and you're still getting your period, they tend to be higher in the follicular phase than in the luteal phase. So you have to make sure that you're getting it tested in the correct phase consistently, and you're comparing those results over time in the correct phase of your period, of your cycle. The other thing is that they can be elevated for up to a year after you break a bone, and they can be elevated for up to 48 hours after somebody exercises. So, and other things, for example, with CTX, if you have other conditions like lupus or a cardiomyopathy, other conditions can also elevate some bone turnover markers that aren't necessarily related to what's going on with the bone. All of those, if you look in the research literature also, the results aren't standardized. There are working groups now that are working on that. And I say this because I get patients all the time coming to me with their results, and their doctors have said, specifically, I'll give you an example. They tested a couple of markers and they said, well, you're a fast bone loser. You're losing bone quickly, but we expect that to change over time as you go through and finish menopause. But the research doesn't really support that statement. Those bone turnover markers can only predict the rate of bone loss in 40 to 50% of the time. So people are relying on these, and unfortunately, we don't have phenomenal testing. I think it can give you some information, but the recommendations currently are those are only to be used to monitor whether somebody is compliant with your treatment. It's not to predict fractures. It's not to predict bone strength. The most consistent predictor of whether somebody is going to break a bone, when you look at the literature, is not any test. And that's one of the things I love about this. It just becomes very practical. It's somebody's gait and their mobility. How is your balance? How steady are you on your feet? Because 95% of fractures occur because somebody falls. So anything we can do to prevent falls is going to prevent fall-related injuries, including fractures. It's important to prevent fractures and really focus on that as the goal. Because if you have osteoporosis and you fracture a hip, there's up to a 36% chance that you're going to be dead within a year. And if you happen to survive, about half of those people who survive never regain their full pre-fracture, pain-free life, level of mobility, enjoyment that they had before. And a significant percentage of those people need ongoing care because they can't even accomplish their full activities of daily living by themselves, like dressing themselves, going shopping, feeding themselves, those showering, those sorts of things. And in fact, this is such a global health issue and health problem that it's second only to cardiovascular disease as a health concern. And every 30 seconds, someone with osteoporosis is breaking a bone somewhere.
That's so crazy, mind-blowing how prevalent it is. And isn't it true that if you're 65 years or better, if you break a bone, like a hip, you are at an increased risk for death for the next decade? Like you're just
That's
all
correct.
causes.
That's correct. Your increased risk of dying is elevated for the next 10 years. And with a hip fracture and with a vertebral or spinal fracture, it's the next 5 years.
So insane to me. Um, I don't think I ever appreciated how widespread or large that statistic was when I was a student many, many decades ago. And I just want to mention to our listeners, the average American woman goes through menopause about 51 and a half years of age. That's when we've completed menopause. So if you're approaching your 50th birthday or 51st birthday and you are going through transition, it might be a time to start checking in with yourself about your balance and thinking about getting a baseline scan of bone density. I've heard of another tool to help assess risk of fracture called FRAX, FRAX.
Mm-hmm.
Do you recommend people take that test? I am wondering, is it worthwhile for our viewers to take their DEXA scan scores and compare it to their FRAX scores?
It's another piece of the puzzle. Frax is a free online tool that will give you a probability, a 10-year probability of a fracture. And you enter different data like your whether you're male or female, your age, if you have DEXA scan results, your T score. It will account for a couple of medications like prednisone. That category of medications, glucocorticoids, just is deadly for the bones.
Mm-hmm.
And but it misses a lot. There are a lot of variables and risk factors for osteoporosis that it doesn't capture. I think, like the bone density test, it is another opportunity for people to become aware and to start becoming more proactive into learning what they can do. But I don't think anybody should put too much emphasis and overemphasize any single test. And let me give you just a quick example of what I'm talking about, of how misleading some of these tests can be. I had a conversation with a patient just yesterday. She was very concerned. She had a bone density test result, and she got her follow-up test result, and her bone density was stable essentially. But it said on there that she had a 1 point, if I'm remembering the numbers correctly, 1.4% 10-year probability of a spinal fracture, of any fracture, and a I think about a 7.4%, 7.1% risk of 10-year risk for a hip fracture. So she was really freaked out. I said, let's think about this another way. That means you have a 98.6% chance that you're not going to break any bone in the next 10 years. And essentially, basically a 93% chance, 94% chance that you're not going to break a hip in the next 10 years. So the way that this is discussed in the clinical setting just sends shivers down people's spine. It is scary to people. And I like to put the test results, the disease, within the context of what are the opportunities here, because it is serious, but it's not an emergency. There's time to educate ourselves, to educate yourself, to understand what you can do, to understand your risk, and put a holistic bone health plan in place and be proactive. You likely did not lose bone density. Your bones did not begin to decline in their health overnight. This has been decades in the making, typically, unless, of course, there's some medications that you're taking. And I'd love to discuss those as well. There's some medications that are just horrific for bones. But generally speaking, this is a chronic process. And it's going to take years to rebuild that bone strength. And it's more than just the mineral content of bone. So why is the bone density test not that predictive for fractures? It's because it only measures the mineral part of the bones, like the calcium. But bones are a complex tissue. It's more than just the minerals. There's also the non-mineral component of bone, or the extracellular matrix, or what we can focus on within that are the proteins. There are 180 to 200 different proteins in bone. The major protein, one of the major structural proteins, is collagen.
Collagen, yep.
And it's that collagen that gives bone its ultimate quality or its ultimate strength, not the minerals. In fact, the minerals bind to the collagen. If you were to take a chicken bone and you were to soak it in vinegar, which I've done, and my histology professor did that in class. It was a great demonstration. Brought a demineralized chicken bone into class, no more minerals, and it was just the collagen left, just the connective tissue. You can bend it, you can hit it against a wall, you can run over it with a car. It won't break. It's like a rubber chicken bone. But if you were to strip away all the proteins, if you were to remove the collagen from the bone and you're just left with the minerals, it's brittle like a column of chalk, and it's easy to break. So there's other things that we want to focus on besides just those minerals. One of the things that's so important with respect to diet is making sure you're getting enough protein. Now, the diet that's associated with the lowest risk of osteoporosis, a 20% reduction in osteoporosis risk, but more importantly, a 21% reduction in hip fracture risk, is that Mediterranean dietary pattern. That is primarily a plant forward diet, lots of fruits and vegetables, legumes, whole grains, lean proteins like fish and chicken, not a lot of red meat. There are guidelines in my book exactly what it is to teach people and how they can transition to that. But importantly, the research also supports that you have to have enough protein. The USRDA for protein as we get older is insufficient to maintain healthy bones and muscles. And
Agreed.
so, even despite the keto high protein craze that's out there, over and over, when I talk to people, they're not getting enough protein. And just consuming an adequate amount of protein can account for 2 to 4% of bone mineral density.
I'm I take the stance that as a physician, my job is to motivate, educate, and inspire my patients. And my patients will tell you I'm always talking about protein, quality of protein, whether it's plant or animal based on what their body needs. But people come in and they are eating 40, maybe 40 grams of protein a day. And I'm like, that's not enough to keep muscle. It's not enough to keep your bones healthy. And if you can't eat, face a breakfast in the morning, how about adding a scoop of a good quality hydrolyzed collagen to your coffee so that you can get some good protein and better get easily to absorb collagen, 1 in 3 type collagen into your body to help with repairs and to replenish those hungry muscles and bones that are ready for something. Absolutely. I'm right there with you on food is medicine and getting more protein into our bodies. And folks, if you have chronic kidney disease, you should talk with your doctor about your appropriate protein amounts. And if you have other medications that you're taking that might interact with protein in your diet, again, talk to your doctor about what is right for you. But I think in general, most healthy Americans do not get enough protein on a day-to-day basis.
I absolutely agree with you. And in fact, the research on hydrolyzed collagen as a dietary supplement in bone health was so strong that a few years ago I came out with a type 1 in 3 NBI collagen product specifically for that purpose. And looking at getting enough protein, and the research supports, again, you're right, I'm glad you said it, people without chronic kidney disease, but looking at getting, if you take your body weight and multiply it by 0.6, that's about the number of grams of protein per pound of body weight that you should be consuming a day. Now, my protein requirement is around 90 grams. I have a hard time getting that every day. So I take a protein supplement to bridge that gap. And I'm a believer, even though I own a dietary supplement company, I'm a believer that dietary supplements should be used exactly as the FDA intended. That is a supplement to a good diet. Diet and lifestyle are always the foundations always the foundation. Then a supplement is there to bridge the gap. Or in the case of bone health, where there's good, solid research and clinical trials showing that specific nutrients in doses in certain combinations powerfully promote the physiology and health of different organ systems like the bone to improve health, then that's the argument for adding those supplements. But I would rather have somebody spend less money on dietary supplements, only using a very targeted approach, and more money on healthy food.
Agreed. You can't out supplement a bad diet.
Nope.
And with the fact that we have busy lives and we are in the car at pickup and soccer games, and I know that I'm guilty of this. Sometimes the drive-through with hangry kids is the most naturopathic option, but that is not our baseline, and that shouldn't be anyone's baseline, in my not so humble opinion. And we've also, with the way we practice farming in this country, have lost a lot of minerals and nutrients from our food supply chain. I have a whole rant on this. I'll get off my soapbox, but I think I agree with you. Mediterranean style eating is what I recommend to the vast majority of my patients. It's anti-inflammatory, filled with colorful fruits and vegetables, lots of prebiotic fiber and fiber. Just most patients seem to thrive on it. I love adding in the collagen as a supplement, especially for my patients who work out, and that anabolic window of the first 15 to 60 minutes after working out, your muscles and your bones are primed to have even more protein absorbed to utilize, build, and repair all that stress that we put on it from, running or lifting heavy things and putting them down over and over. So absolutely love the collagen supplements, such as the one MBI has with the types 1 and 3 collagen. I also want to mention for our listeners that unlike protein powder shakes, you can't bake with those, but you can bake with collagen. It's something that you're able to throw into a muffin mix, or say you do whole grain pancakes on the weekend, throw a scoop of a collagen powder in there and it won't change the texture or the flavor. It'll just add a little extra nutrition to your meal.
And in fact, on my website, I've got a free download that people can, a PDF that they can download that has collagen recipes in it that I actually put together. And my daughter helped me. It was really fun to do as a project together. But I love what you said about being able to absorb more protein after exercise, because it touches on the dynamic nature of our bodies, that they're not static. These are always changing dynamic organism that is responding to its environment. One of the things that I think about is the absorption of vitamin C. When we're sick or when we're fighting a cold, our ability to absorb vitamin C, which is used by our immune system, goes way up. We can absorb a lot more because the body is able to utilize more. And it's similar with bones in terms of when we give our bones the raw materials to do its job, they work better. We can rebuild bone. We can increase bone density. We can maintain strong bones because that's what your bones are primed to do. One of the challenges in our society is identifying, however, and removing things that are destroying our bones. Because if you're constantly assaulting your bones with things that are damaging it, it makes it hard or impossible to repair and build new bone. One of the things that is so common, the categories of challenges that are assaulting our bones, are medications. And that is an under-recognized danger within the conventional and the general medical community. Two of the most commonly prescribed categories of medications are horrible for bones. Those are the antidepressants, specifically anything that artificially raises serotonin, like Prozac, Lexapro, Wellbutrin, any of those. People taking those medications, like an SSRI or an SNRI medication. Research has shown that women taking an SSRI medication for 1 to 5 years, for every 19 women taking them, we will expect 1 to break a bone.
It drives me crazy that we prescribe antidepressants to manage menopausal symptoms, because you're already in that window.
Crazy, right?
But it's a matter of us taking the time to educate our patients so that they can, also educate their other providers.
Correct.
And we're all just here to be a support network for each other for a healthier community. And that's my stance. Don't villainize, just educate.
And providers that are prescribing them, they're not doing it maliciously.
No.
They don't understand. In fact, a study was done a few years ago where for women who ended up in the hospital with a hip fracture and osteoporosis, they looked at the medications that they were taking for the 4 months prior. And then they looked at the medications that they left that they were taking after the hospital. And what they found was that over 75% were taking a medication before they broke a bone that increased their risk for fractures and falls. And after they left the hospital, the number of patients taking medications that caused osteoporosis, caused fractures, overall didn't change. Because what happened is where doctors identified there was a medication that was putting them at risk, They may have taken them off of that medication, but they simply put them on a different medication that increased the risk unknowingly. And so it's up to, unfortunately, us. And I love that you're doing this with your podcast to educate listeners, to educate patients with my book in any way we can, so that they can take this information back to their providers and start asking better questions. In different chapters in my book, and specifically the one on medications that damage bones, I have take action sections. So in Fracture Proof Your Bones, in the different chapters, is take action sections. And in those are with them, write down all the medications you're taking and take them not just to your doctor, but to your pharmacist. Pharmacists are such an underutilized, amazing resource in our healthcare system. And ask them, they have databases that they can quickly look things up in. And just to make sure and validate that what you're taking is not having damaging effects on your bones. Even acid blocking medications, proton pump inhibitors that are available over the counter. We've known since 2000, I think it was 2010, 2009 or 2010, the first warning letter from the FDA went out about this category of medications causing osteoporosis and fractures. Now we know that people taking them continuously for 4 years have up to a 60% increased relative risk of hip fractures compared to those who are not taking them. And yet people are just popping them like candy.
What drives me crazy is that patients will go into the hospital for surgery. They get put on these PPIs to help manage symptoms of whatever while they're in the hospital. And then they somehow never seem to go off them. They just continue with the acid blocking, Nexium, whatever it is, just long term. I've seen it time and again. And you ask your patient, well, why were you put on this? Well, I was put on it in the hospital. And then their primary care or their family practice doctor or their internist is like, okay, I'll just write a script to continue that. But why? They haven't been studied or approved for long-term use for most people. And if you're having severe heartburn every day, it's probably time to talk about diet, lifestyle, and other things that can be done to help mitigate some of that, like timing when you're eating, going to bed, maybe with an empty stomach. And
try eliminating the 5 most common foods that cause acid reflux. 50% of those prescriptions for PPIs are because of acid reflux. But as we know, there are some common foods like chocolate, raw onions, garlic, citrus, spicy foods, coffee that can commonly cause heartburn. And so just removing those and experimenting with that, maybe it's something else that's aggravating it. And doing that experiment can be very helpful and allow somebody to not have to take that medication. Let me tell you a story that I found super just shocking. What happens in the world of osteoporosis is the vast majority of the research on the medications for osteoporosis are done on postmenopausal women with osteoporosis. There's a lack of clinical trials on people with osteoporosis caused by other things like medications or cancer treatment-induced osteoporosis. And what happens then is that doctors start prescribing to patients with osteoporosis medications that have never been studied for the underlying cause of their osteoporosis, assuming that it's going to work the same. This is the case for osteoporosis caused by acid blocking medications, those PPI, proton pump inhibitor medications.
Wow, I didn't realize that they hadn't been studied in that particular class.
Well, then they were. So what happened is they were just giving them, assuming they would work, and people decided, well, let's study this and see if it's actually true. There have been multiple studies. What they found is that when somebody taking a proton pump inhibitor with osteoporosis also takes Fosamax or an oral bisphosphonate, their risk for fractures is higher than people who are just taking the PPI alone and not taking the medication. Giving the medication for osteoporosis in combination with the proton pump inhibitor increase their risk of fracture even further. I mean, it's crazy. And most doctors aren't aware of that. So that's my book. My book can really be a resource for people because there's a whole chapter on medications in there as well.
It seems that a lot of people are on medications that could cause osteoporosis, and not just osteoporosis because they're on the medication, but just make them dizzy or have hypotensive episodes. Say, like my grandmother, bless her, she lived to be 100, healthy almost all of her life.
Amazing.
May I be that lucky. Uh, at the age of 95, woke up in the middle of the night, fell and broke her hip. And she'd recently been put on some medications to help with anxiety and depression as she was developing dementia. And I look at that and I think, would she have fallen in the middle of the night if she wasn't on those medications? Because those medications have a side effect of making people have dizziness or vertigo or have it. So I know that many of our listeners know someone who's aging and maybe on a medication. Is there other things that we should consider, not just glucocorticoids or medications that cause fluctuations in serotonin that we should think about when we're looking at holistic approaches to medication review?
Absolutely. You talk about your anxiety medications. That is a common, those are commonly prescribed, not just for anxiety, but for insomnia. And those increase the risk for falls, which increases the risk for fractures. And those are commonly prescribed to the elderly. Antihypertensive medications, also commonly prescribed in the elderly. If they are too high of a dose, that also increases the risk for falls and fractures because somebody can get too low a blood pressure. But specifically, when we're talking about the anxiety medications, the benzodiazepine or benzo-like medications like Xanax, for example, as people get older, above 65, for example, their ability to metabolize and break down the drug decreases. And so they're at even a higher risk for getting over medicated. And 94% of the elderly are on a medication that increases their risk for falls. So looking at those medications are important. In addition to that, there are anti-seizure medications can damage bone, certain ones, not all, but there are certain categories of anti-seizure medications that will do that. Or if you're on a dose of an anti-seizure medication that is higher, a higher dose, or if you're taking more than one at a time, that increases your risk. Immune suppressive type medications will increase the risk for fractures, like methotrexate, cancer, chemotherapy, like aromatase inhibitors that block estrogen production. For women taking an aromatase inhibitor, it's commonly prescribed for breast cancer. We expect 20% of them, or 1 in every 5, to break a bone from osteoporosis in 5 years of taking it. There again, there's just quite a long list of medications.
That is absolutely mind-blowing. I do want to caution our listeners, please don't go off your medication before having a conversation with your provider. And if you're interested and can find a local naturopathic physician, we are trained with functional medicine in mind and to treat the cause of what is causing the symptom. It's removing obstacles that are causing illness and tonifying systems that might be weakened. And you may be asked to do things that you don't like changing your diet, changing lifestyle, and improving the quality of your sleep, just supporting your whole body. But it definitely is, in my opinion, better to have supportive foundations and providers who educate you on why it's important than just to be like, no, don't go off then to be like, oh, okay, go off your medication. And here's this other medication, which may also have the same negative side effect for things like causing bone mineral resorption.
But even if you are taking medication, there's still a lot of things you can do. Ideally, you can decrease the dose or switch to a safer one. But there are clinical trials with MK4, 45 milligrams a day, that's in my products, with people on prednisone, with people who are on an androgen deprivation therapy, leuprolide, for example, that's used in men for prostate cancer and other conditions, showing that it stops, been able to stop that bone loss by medications. So there are things, and also anything you can do to improve balance through exercise, build muscle with diet and exercise, promote healthy sleep. All of those things may be able to, counteract in some ways the increased risk for fractures caused by a medication that you're taking.
Speaking of sleep, in your fantastic book, Fracture Proofing Your Bones, there was this discussion about our bones being part of our endocrine system. And and it's something that I hadn't seen discussed widely in other places online and in other books. And I love that. But you mentioned that our bones create melatonin, which traditionally most of us think of as our sleep hormone. And in that it kind of just was something that helped us shut down and go into REM sleep. But because the bones are making melatonin, that it was something that regulated and stimulated the creation of new bone. Can you give us, given this information, should we all start taking a melatonin supplement to improve our bone density?
I'm not a big fan of saying everybody should do X, except for healthy diet, sleep, exercise. Not there, not everybody has to take melatonin, and there's not a one size fits all, for every individual person. That's individualized approaches are important. I think that if you're not having great sleep, then supplementing, doing practices, sleep hygiene, not eating before bed. If you have acid reflux, you're taking care of that. That can wake you up. If you have sleep apnea, make sure you get that checked out and treated, because that can cause bone loss and is also a risk, not just for osteoporosis, but a risk for heart disease. So it's not necessarily that everybody should take melatonin. And the clinical trials of melatonin, there's only one currently. And it was in postmenopausal women with osteopenia, not osteoporosis. And it showed that there are taking 1 milligram or 3 milligrams of melatonin at night did improve bone density, with the 3 milligrams being more effective. But if you're already taking anxiety medication, what's called a hypnotic, like a benzodiazepine, a Xanax, a benzo-like drug, that already includes, creates drowsiness, then you definitely don't want to add something else onto that like the melatonin, that can make you even more drowsy, without talking to your doctor first and seeing if it's an okay approach to be taking. But melatonin, the research on melatonin is fascinating, and I like it for several reasons. One, it shows that bone is not just by itself this organ that is isolated. It's connected to everything else. Not only are there melatonin receptors on bone, there are also serotonin receptors on bone. And in fact, when you look at melatonin and serotonin, the vast majority of melatonin and serotonin, over 90% of each of those, are not even produced in the brain. They're produced outside of the brain and have other effects throughout the body. And in the bone, both serotonin and melatonin help to modulate bone health. So again, it's all about creating that system and creating the environment to allow your bones to thrive and do what they're wanting to do. It's about balance. In its most fundamental, basic form, osteoporosis is a disease of imbalance where the destructive forces are winning. And it's our job to help restore that balance and tip it in the favor of rebuilding healthy bone. So over time, bones can not only get better bone mineral density, but get stronger and healthier, so you can stay safe and healthy and vibrant and enjoying your life as long as possible.
I love that. Love that. I just have a couple more questions. Just because this is becoming such a common use medication, I want to talk a little bit about any concerns for osteoporosis and GLP-1 reductase inhibitor medications like Ozempic and Mounjaro. I found a systemic review of GLP-1 agonist medications that suggested that taking these medications actually improved bone density through a couple of different mechanisms, including just decreasing glucose levels, and having high blood sugar all the time is one of the things that can cause bone resorption, and also that it upregulated osteoblast building of bone in our bodies. Do you have any information about GLP-1 medications and osteoporosis that you could share with us? Any wisdom or thoughts on the medication?
You did a great job of summarizing the current knowledge. I don't have any concerns with those medications for the reasons that you stated. It's similar to metformin in a way that's used in prediabetes and diabetes to lower blood glucose levels, blood sugar. And elevated blood sugar is a known risk factor for not just diabetes, but osteoporosis as well. And so those GLP-1 medications seem to have similar effects and may be beneficial to bones. I don't have any concerns currently with anybody taking those in terms of bone health.
Great, great. I don't expect an answer to this, but I'm wondering if a GLP-1 type probiotic is in the works for NBI in the future, just being Akkermansia, being a gut bacteria that can help us increase our GLP-1 production naturally. Just planting the seed. Maybe you could start working on a great supplement for that.
Well, you raise an interesting point about the gut bone connection. And I've lectured at medical conferences, given continuing education talks on that. It didn't make it into my book because the research was a little premature at the time when I was writing the book. But I'm working on the second edition of the book, and there's definitely going to be a part on that. And here's what we know currently about the role of probiotics in bone. It does seem to have an effect on bone, but all the clinical trials when the outcomes were bone density or bone strength, they're all in mice. There are two studies, one with just a single strand. None of them were Akkermansia, a single strand probiotic and a multi-strand probiotic, and both improve bone density in the mice. So we don't know which combination, which one is best to use, or how long somebody would need to use that. And there are no fracture outcomes. A recent study came out looking at a bone turnover marker, CTX. I was asked by a medical journal actually to do a review of that study that it's due to them later this month. I've got to review that research for them for print. And it tested CTX and showed that CTX, that bone turnover marker I mentioned earlier, that is a measurement of the breakdown of collagen, did decrease. But as I talked about earlier, that's not a great marker necessarily, for bone health, and to kind of hang your hat on and say, this is the end all be all. Really, we want to look at, at the very least, bone density, but more importantly, the endpoint ideally would be fractures as well. So I think the research is premature. What we do know is there is a connection between the gut and bone health. People with chronic intestinal diseases like irritable bowel syndrome, Crohn's disease, ulcerative colitis, people who have bowel surgeries, they're at a much higher increased risk for osteoporosis and fractures than the general population. And there are multiple mechanisms that are at play. One of them is chronic inflammation that can damage the lining of the intestines and allow things through the intestinal wall that shouldn't be going through. And inflammatory chemicals, or what are called cytokines, that those actually go directly to the bone and increase osteoclast activity. That's bone breakdown activity in the bone. So there is definitely a gut bone connection. And if somebody's having any issues with their intestinal health, that is an important, I think, piece of overall health and puzzle, but also will benefit and impact bone health.
Love it. Love it. John, do you have anything else you'd like for our listeners to know?
Like I said earlier, one of the most important things I like to tell people is this is a scary diagnosis, but it's not an emergency. I try and reframe that bone density test result, put it in its proper place. It's just one piece of a larger puzzle. So everybody can take a deep breath. There's time to educate yourself, there's time to learn and put a holistic bone health plan in place that makes sense for you.
Wonderful. Thank you so much for taking the time to be on the ReBootology Health Natural Solutions for the Health and Happiness of the Modern Woman podcast with me, Dr. Rachel Winstead. You can learn more about Nutritional Biochemistry Inc. supplements and purchase Dr. John Neustadt's new book, Fracture Proofing Your Bones, A Comprehensive Guide to Osteoporosis at mbihealth.com. And this will be linked in the show notes below. If you like what you hear, you can listen to this episode and other episodes on YouTube, Apple, Spotify, and wherever you get your podcasts. Remember to check our show notes and subscribe to the ReBootology Health podcast newsletter to get even more great health tips, as well as learn about any upcoming interviews. Thank you for joining us.